It is Tuesday, September 22nd. Welcome to the Task Force update. It is our 131st update, and today's is the first in the autumn of this year. We have gone through 2 entire seasons of COVID-19. It started actually at the tail end of winter, and well, that's the way it goes. We're still here, and we're still battling it out. And joining us today, we'll have Lisa Westaway from the Kahnawà Memorial Hospital Centre, but we'll start things off with the Commissioner of Public Safety, Lloyd Phillips. Lloyd?
Thank you, Joe. Good afternoon, everybody. Well, let me start off today, but I just want to cover a few topics very quickly this afternoon. One, first and foremost, if you haven't already heard, there was a discussion on Monday with the council, and it was agreed unanimously that to extend the state of emergency in the community. There certainly was hope throughout the late part of the summer that we would be able to evolve out of a state of emergency and into a state of more normalcy, but unfortunately that was not the case. We were looking at it very closely over the past few weeks, and given the progression of the second wave of COVID-19, it was a unanimous consent that we must remain in the state of emergency. And the primary purpose for the state of emergency is to ensure that we utilize Kahnawake jurisdiction and Kahnawake laws to put legal effect and into the directives, mandates, and measures that are done by the task force, so that if need be, the Court of Kahnawake can hear them. Directives are enforceable by the inspectors if need be, and obviously the Kahnawake peacekeepers. Other jurisdictions have other measures they could use, such as public health emergencies or other legislation that they have on their books, so they don't have to have a state of emergency. So they may have different ways of achieving the same goal, but the way the emergency preparedness law is written in Kahnawake, it must be enacted by an MCR, for it to have legal bearing. And so that's why we had to continue with the state of emergencies over the past 6 months now, to maintain the measures and maintain the mandate of the Kahnawake COVID Task Force. So that's, again, obviously something that we're going to continue monitoring as we move forward. There's also was a mandate given to legal services and myself to look at some modifications to the emergency preparedness law that would allow for a transition phase, a recovery phase of the state of emergency, whereby state of emergency can be lifted, but also at the same time keep some measures in place, to wind down an emergency, so to speak, but also have that mandate be maintained for the task force. Now that will be presented back to council in the coming weeks, and at that point in time, there will be a discussion on whether or not we maintain the state of emergency, or if we look at alternate options. Obviously, a lot of that's going to depend on what's happening in and around Kahnawake. Now, speaking about around Kahnawake, obviously our numbers has been zero since very early in the summer, which obviously we're very happy and very proud that is the outcome of all the measures that we have taken, and a lot of hard work done by the task force and by the community as a whole. So and obviously we're very proud of that. And moving forward into the second wave, that is ultimately still our goal. But around us, if you go back as early as August 16th, the average, that week of August 16th, the average rate of infections in the whole province of Quebec was around 50 per day. Then if you fast forward a month to August 16th, the average was around 250 cases per day. So in 1 month, it went from 50 to 250 per day. And then in a short time, a week later, the week of this week, matter of fact, 21st, 22nd, we're looking at an average of over 500, about 530 cases per day over the past several days. So we can see, if we put that on a chart, that the increase, again, is increasing substantially. And as we know, we said many times, throughout the pandemic, especially earlier on, about flattening the curve, bending that curve. Those are things that we're certainly going to have to start looking at that type of language once again, because that curve is definitely on a steep incline at this point in time. Fortunately, that's not resulting in a lot of deaths at this point in time, which we're grateful for. But if the numbers keep increasing the way they are, eventually, unfortunately, we will be seeing people getting very ill and seeing deaths, throughout the province. That's why it's important to understand the measures that we take now to act and prevent that further numbers, have a direct impact on what will happen in the weeks and months to come. So it's time for us as a community, and even those who are not from Kahnawà listening in, it's time to us to be extra vigilant, compliant to measures, and be aware of your surroundings very carefully. Because it also is important to note that some areas around us, I'm sure you heard, Montreal has been moved from a yellow alert in Quebec system to a orange alert, which is the second highest alert that they have. As well as today, there was additional moving from yellow to orange in Laval, which is a different region in Quebec, as well as the Westaway region, which includes areas in Gatineau, very close to the Ottawa region. So things are progressing quickly. Obviously, we're watching that very, very closely from the task force perspective and seeing what's happening around our community. And one also note that what was raised today is the way this second wave is starting to evolve is it's different in many ways, because some of the areas such as Quebec City, who did fairly well during the first wave, are already seeing a dramatic increase in cases, and they already moved from yellow to orange in the Quebec City region, which again they haven't seen it that bad during the first wave. So how things are playing out, obviously, the experts and epidemiologists and so on are watching that very closely, and so are we, along with, obviously, we have our medical advisors and our experts helping guide us and to make the proper decisions for our community, at the proper times. We do have a plan in place for the second wave. We have been initiating that throughout the past few days, but we are going to be releasing more information on that tomorrow, and which will give a overview to the community on where we are within the pandemic. We also decided that we will use colors the way that Quebec had done it, again, just to maybe make it so it's clearer and less confusing. Because we were originally going to do it in steps, but we decided to use the color coding, I guess, to make it clearer. But understand, there is the Quebec plan, and there is the Kahnawà plan. And Lisa's here, and she has a few things to talk about. She'll also expand upon that a little bit more. So with that, I'll see you again soon. Take care and be safe.
Good afternoon. So I'm going to go back a little bit from what Lloyd was discussing and talk a little bit about Quebec. So Lloyd mentioned that there are several regions that have moved into their orange phase. This is an alert mode, and it brought about some changes, especially with respect to gatherings within these regions and in Quebec in general. So we think it's important that you know about them. They're not necessarily specific to Kahnawà because we have our own measures in place already for gatherings that were a lot more restrictive than what Quebec had put in place. But we think it's important that we share the information if you haven't seen it in the news. So basically all through Quebec, as you remember, gatherings were set at 200, public gatherings were set at 250 people. So throughout Quebec, that number is now decreased to 50. So public gatherings can no longer be more than 50. In the regions that are orange, so the ones that were mentioned by Lloyd, those are now at 25. And therefore, all those regions that are in the orange sector, public gatherings are at 25 people. The only areas that are maintained at 250 people are large theaters where there are shows and people are seated facing in a certain direction. Those public gatherings are maintained at 250, but otherwise we're at 50 and at 25 in the orange zones. The reason for this is when Lloyd mentioned that this second wave is slightly different than the first one, it's really based on the source of the transmission of the virus, and that's why there's a lot of emphasis being placed on gatherings, because we see that gatherings account for the biggest mode of transmission of the virus in the second wave. We also see that it's youth that are the biggest jumps in numbers. And therefore, they're really trying to look at minimizing the transmission within that population, that age category, and within gatherings. So another change that they've made is in those orange zones is that alcohol can no longer be served after 11 p.m. and bars will close at midnight. Their theory is that a lot of the transmission and people stop respecting social distancing after midnight. So it goes with that saying that nothing good happens after midnight. They're basing their decisions on that philosophy. They've also limited in the orange zones private gatherings from 10 to 6 and up to a maximum of 2 families. They agree that you can go to 8 people if it is a maximum of 2 families of 4. It's a little bit confusing, but that's what's happening in those orange zones. So when you go visit friends in the Montreal area, you are allowed to go into their home if you are a maximum of 2 families. And police have, they've worked hard, Quebec has worked hard on giving their police force extra authority to be able to go into people's homes, into bars, into gatherings in order to give tickets or give tickets basically if people are not following those measures. So those are some of the changes that have happened. Again, as we've said, in Kahnawake, we've always remained more restrictive, and therefore at this point, and based on the data that we have presently, there are no changes. So our public gatherings, public do not mean in your backyard. Public is in a public forum, so they're still at 50. Private gatherings, so that means in your backyard, in your home, they remain at 10 for the present time. And again, we may be seeing changes to that in the coming weeks. So those are the major changes that have happened in Quebec. What that means for us and seeing what's happening around us means that we have to start looking at how changes might progress for us. So Lloyd mentioned that we're in the process of doing our planning. We will be releasing some of that planning or more details regarding our plans tomorrow, but we are following a very similar format. So I just wanted to show this. This is not the same document, not this document. So this is how you'll see all of our branding and our communications will be based on these colors. In fact, green, we never got to green in Kahnawake because we've been more restrictive. So we sit in a yellow state right now. And you'll have details tomorrow about the progression through these colors, through these phases, so that there are no surprises to you over the coming months. Again, I'll just repeat the criteria that we use in order to determine how or when we move through those phases. So it's the number of positive cases, it's the percentage of positive cases compared to our total amount of people tested, it's our ability to contact trace within 24 hours, and of course we look at the data from the surrounding communities in order to help us make decisions, because we don't live in a vacuum and we are drastically impacted by the communities that surround us. So again, those are the elements that we'll use to help us determine how we move through phases. Another important point is that we may not just simply go from block to block to block to block. There may be elements within a specific phase that we will modify, and again, it's based on the analysis that we do of the situation. So it's never black and white. We can never give absolutes. Every decision that we make is based on an analysis of what's happening around us. So if I use Quebec, for example, they've made changes to gatherings. They've made changes to their residences and how people access or not, and I'll speak a bit more about that later. But they haven't necessarily moved completely from one block to another. They may also make decisions based on specific regions, or even they may break down regions into sub-regions. So we may do that as well, and it's always based on our analysis. So if we do ever have a positive case within the community, our ability to contact trace, understanding where the case came from, how many contacts there were, all of these questions provide us with answers and the ability to make appropriate decisions about how we move forward. So speaking about gatherings, speaking about the residences, the long-term care facilities, Quebec announced also some changes to a visitation in orange sectors regarding visitation. So orange sectors, the long-term care facilities, are only now open to visitors for humanitarian reasons, so palliative care visits, or if a person is a natural caregiver. And so that's important. The reason why they've made those changes in those areas is because there is now happening an increase in infection and virus transmission within long-term care facilities. And there are some serious outbreaks in quite a few long-term care facilities. So not at all the numbers that we saw in the past in the first wave, but it's the beginning of. And just a reminder that we see that transmission is happening amongst youth right now, but we know that those youth will eventually and are in contact with elders, with seniors, and we expect to see an increase in the vulnerable population being impacted by this virus over the coming weeks, 3 to 6 weeks. And so that brings us to our community, to Kahnawà, and our long-term care facility at KMHC. Today I'm only speaking for KMHC, and you should receive shortly information about the Elders Lodge and ILC. However, I'll just explain a little bit about KMHC, so we can show this one now. So as you know, we reopened visitation at KMHC in phases. So just a reminder, we started off in the outpatient area at a very large distance, then we moved closer with hand-holding, then we were bringing visitors up into individual rooms, and right now we are allowing family members to take their loved ones on walks on the bike path. So we had a phased approach, and it was always based on numbers, based on our analysis of what was happening around us. So numbers within the community, but also in our surrounding communities, always mitigating risk as much as possible and ensuring safety and little to no transmission of the virus. So we've been successful thus far. We use that same philosophy in order to look at phases for closure of visitation. I say closure, but it's in fact limitations to our visitation. So right now, again, we never made it to the green section. So what you see in front of you, we never actually made it to green, and that's because we always had the virus around us, and there was always risk, and it was not. We did not feel that it was safe to go all the way to green. But presently in the yellow is where we're at right now, and so that's what I just mentioned. We have all of these types of visits in place at KMHC right now. Based on what's happening around us, therefore Montreal in particular, Montérégie is still in the yellow zone, but we expect it to move to orange very shortly. So based on the rapid increase in numbers around us, we feel that there are some changes that we would like to make to this yellow section. So there is, as of Monday, so as of next Monday, we will be eliminating the outdoor walks. We feel that it comes at a good time because the weather is changing and many of our residents are no longer wanting to be outside for long periods of time. We know that it's going to be nice this week, so we are finishing the week. We are allowing the visits that are already scheduled to happen for the walks this week, but the visits will continue. So somebody who has an appointment for a walk, their visit will just be changed to either outside in one of our gardens or inside if it's too cold. And so you'll be called in order to make those changes to your visitation starting on Monday. So again, as I mentioned before, we don't move from phase to phase. So from the green to the yellow to the orange to the red as a block. So right now we stay within yellow. And again, we have 0 positive cases in the community, but many surrounding us. Our percentage of positive cases compared to those being tested is 0% in Kahnawake, but we're way over the 2% maximum that we would expect to see in the community surrounding us. Our ability to contact trace within 24 hours, we actually are only getting results now at about the 48-hour range. Therefore, it takes another 24 hours at least to be able to contact trace. So we're borderline for that one. And again, the data from around us tells us that we have to start being cautious and making changes in order to ensure to protect our elders. So again, just so you're prepared, as of Monday, there will no longer be walks on the bike path, but we will still have visitation in individual rooms, we will still have visitation in the outdoor courtyards, and we will still have visitation in the outside, in the outpatient area, if that's what you choose to do. When and if we move into orange, then we will decrease in our phases in the same way we opened up. Therefore, we will eliminate visits in the individual rooms. And so I see that I have a mistake on my document, so I'm going to have to change that before we post it. And then, of course, when we end up in the red section, we will no longer have visitation except for palliative care purposes or for natural caregivers. And we'll speak to you a little bit more about that as we move along. So I hope this is helpful to you. We wanted to just give you a bit of a warning, but information that allows you to be prepared. And the more information you have, the easier it is to prepare in the hopes that we never get to that phase. And we'll be having a Zoom meeting very shortly, a Zoom family meeting, where I'll present these phases in more detail, and I will ask you for your feedback so that we can improve on this plan as much as possible. I wanted to talk a little bit about schools. It's the second day since the students have come in, and from what I understand, there are a few hiccups here and there, but all in all, it is going quite smoothly. The teachers have had several weeks to prepare. One reminder that I have for all of you is to do their health check with your children before you send them off to school. So any of your children who might have one of the symptoms on the health check should stay home. This is really important. We all have a role to play in mitigating the virus, in keeping it out of the schools as much as possible. And so doing this health check is a good way. It also teaches your children about what to look for in their own bodies, changes that happen, so that they can recognize when they're not well and advise one of their teachers if they happen to be at school, if they start to feel sick throughout the day. So having these conversations with your children is helpful and mindful. I think that's all that I wanted to present today. Again, tomorrow our plan for the progression through the phases, what that means for the community in general. We'll be presenting that tomorrow, so you'll have a better idea of where we're going and what the plans are moving forward. And I hope that this has been helpful. We'll continue to keep you updated regarding what's happening around us. And again, remember masking, distance, hygiene, very important right now. Thanks.
And thank you very much, Lisa. Thank you, Lloyd, as well. Just a couple of notes. First of all, Lisa talk about analysis of the data that's come in. Just so you know, analysis is going on a daily basis, and that's one of the issues that will, or one of the matters that will be addressed tomorrow as the announcements are made about some of the actions that will be taken. And we look forward to that. Also, something we want to clear up, we talked earlier about the youth who are being mentioned as the ones who are most likely to be doing the spreading at this time. This is certainly not the blame game. We don't want to get into that. These are the stats that are being put out there. This is the information that's coming in, and it just goes out to the public so that you know, and hopefully this will help the authorities and everyone to address these issues so that everyone is better protected. Also, just a note, speaking of the schools, the modifications for the school bus services here in Kahnawà have now been completed, and all of the schools are now covered. So it looks like that's one of the hiccups that has been fixed up. Just a little note as well, there will be a task force meeting tomorrow. So it's a busy time, and it looks like we're all done here. So we'd like to thank everybody who's listening live on Facebook Live, as well as our listeners on K1037, and those of you who will be watching this later on, whether it's on Paul's or on Facebook Live. So on behalf of everybody here, we'd like to say thanks for taking the time. Enjoy this first day of fall, and we'll see you next time. Nyao koa dano, onigiwahi.